Hello everyone, welcome to Dentospedia, which is the most comprehensive platform for cracking dental board exam. So today I'm going to teach you a short topic on oral lichen planus from the module of oral pathology. So let's get started with the topic. So what is oral lichen planus? So oral lichen planus is a chronic inflammatory mucocutaneous disease caused by a T cell mediated autoimmune reaction against basal keratinocytes of the oral epithelium. So it is a chronic inflammatory mucocutaneous disease characterized by T cell mediated attack on the basal keratinocytes. Now, it is more common in middle-aged women and it is idiopathic, but it is associated with stress, medication, and hepatitis C infection. Now, see the pathogenesis, how the disease develops. So, cytotoxic T lymphocytes attack basal cells. Now, this causes degeneration of the basal layer, breakdown of the epithelial integrity, and inflammation in the epithelial connective tissue junction. Now, it is more common in middle-aged women and usually idiopathic, like the exact cause is unknown. Now, it is associated with psychological stress, certain medication, and hepatitis C infection. Now, the clinical forms of oral lichen planus. So, you can remember it by the mnemonic BERP, which is BERP. Understood? B is for bullous, E is for erosive, R is for reticular, and P is for plaque-like. So first we'll discuss reticular type, which is the most common type. So reticular type is the most common type. So see, there are white lace like interlacing lines called Wickham Striae. So you can see Wickham Striae. So you can see there is a Wickham Striae. These are white lace like interlacing lines. Now the location is mainly bilateral in buccal mucosa. Now they are usually asymptomatic and often discovered during the routine dental examination. Now second is erosive type. Now erosive type is most painful type. It is most painful type. So there will be shallow ulcers. There will be shallow ulcers and there will be red inflamed border. Now white striae may be present at margins. Location will be gingiva, tongue or buccal mucosa. See, there will be burning sensation and pain while eating spicy or hot food. So erosive lichen planus has a slight risk of malignant transformation to squamous cell carcinoma. Understood? Now plaque-like. See, there will be a homogeneous mass. You can see there is a homogeneous mass, homogeneous white mass or homogeneous white patch. Now it looks similar to leukoplakia. Now location is commonly seen on the dorsal surface of the tongue. Now again it is also asymptomatic. Understood? But it needs a careful differentiation from the leukoplakia. Now fourth is bullous. So you can see a bulla. So there will be a large fluid-filled vesicles or bulla formation. Now bulla will rupture easily and causes ulcer. So it can occur at any oral site and it is painful. It is painful. Understood? Now, see, these are some clinical forms and feature. Reticular, which is most common. You can see white lace striae, Wickham striae, and buccal mucosa, and it is asymptomatic. Erosive, it is painful, and ulcers with red inflamed borders seen in gingiva and tongue, and there will be burning pain sensation. In plaque-like, there will be homogeneous white patch seen on the dorsal surface of the tongue and mimics leukoplakia. Bullous type, large vesicles can be seen in any site, and it is most painful type. Now, what will be the diagnosis? So, see, there will be clinical appearance. So, there will be bilateral symmetrical lesion, presence of Wickham striae, and chronic course. Second is histopathology. So, there will be sawtooth, vertebrae ridges, and severed bodies which are degenerating keratinocytes. So, sawtooth shaped vertebrae ridges will be there. There will be dense band like lymphocytic infiltrate and severed bodies. Understood? Now with the help of DIF, which is a direct immunofluorescence, fibrinogen deposition at the basement membrane zone is seen and it helps to confirm the diagnosis. Understood? Now what will be the treatment? So see, for reticular lichen planus, no treatment is required. Only regular follow-up is done. For erosive symptomatic type, topical steroids like clobetasol or fluoxetinoid is given. Understood? Systemic corticosteroids or immunosuppressive drugs are given in severe or resistant cases. Understood? So erosive lichen planus has a slight risk of malignant transformation to SSC. So lichen planus usually presents as a bilateral white lesion, and reticular type is the most common and asymptomatic. Now erosive type is painful and potentially pre-malignant. Now long-term follow-up is essential. Understood? So that's all for oral lichen planus. For more detailed video, please download our app Dentospedia, and please do like, share and subscribe our channel. Thank you very much.